the most important change in my career came when I started to work for the patient expectation in order to meet what patient was looking for and not only for publishing data into the literature. Again, what mucogingival aesthetic surgery, as the name tells us, would be much more addressed to satisfy what is really patient request, and so we have to evaluate much more what the patient is capable to realize of what is our outcome in terms of surgery, and it's the patient that will guide us what we are going to do in the future. I try to teach, but this is from quite a long time, what I think about the future of periodontal surgery will be, and not to be too much close what was done into the past, because we really need innovation, we really need to improve, because many things changes from the possibility we have today with the digital way of working, with the new instrument, with the improving the skills in the surgery, to give something that we were not able to do and to give to the patient in the past. For sure, to win as the first Italian the membership, the honorary membership of the American Academy of Perio was one of the most important recognition I achieved in my life, because, you know, for all of us, United States of America has always been the place where people go to learn, and now I think that it's very important that also Americans ask for us to teach. This is my way of living. Try to improve. I'm never happy what I've done the day before, so this is my life. I always try to improve, and this is exactly the same that I try to put in my profession, to improve and to make patient much more happy. I think that I did some good work, that it's still what most of the people in the world do in terms of soft tissue management, but there is also something I published in my life that is not useful anymore, and this is something that everybody should recognize. Yes, I wrote 2 books, one on the mucogingival surgery around teeth, and the second one around implant. And in both cases it was to give the clinicians a guide to know what to do for every single day patient, every single day surgery. It's really a surgical guide with, as much as possible, the biological background behind these surgical techniques. I'm mainly working on the soft tissue management around implant. I think there is a lot of things to do for the future, like it was done around teeth in the past. We have to start to work again from the hand, which is the expected outcome, that is patient satisfaction, and this will modify a lot our approach in implant therapy, especially in the aesthetic zone. This is my first experience from a teaching point of view in India, so I really don't know the level. I saw that there is some good publication that were done by Indian people into the literature, so I'm expecting quite a good level, but now it's really a surprise. I will tell you something more when I will come back. Be a periodontist from all point of view, which means that we have to know exactly how to treat patient that has a disease compared to patient that have no disease but have only aesthetic complaint. Be a periodontist because you need to improve your skill in making surgery, and this is something that I think that it's not possible to wait for the intelligence artificial skills. It's something that we have in our hands, in our brain. It's not easy to communicate it to a computer.